There was an awful lot of enthusiasm yesterday after it was learned that Pfizer's vaccine may well be 90% effective and may be tracking to be produced sooner than some had feared, as soon as some had hoped, in fact. One of the questions that remains is just how much will be produced and at what pace, and who gets their hands on it first. Here in Canada, we are in line for some doses of that vaccine. With us now, Anita Anand, Public Services and Procurement Minister. And Minister, thank you very much for being with us. And I did want to start with the announcement itself from Pfizer. We know there are a lot of things that we still need to see and will happen between here and there. But where do we stand as a country in procuring, getting access to this particular vaccine?
Well, Amanda, thanks for having me on. It's great to chat with you again. In terms of the Pfizer announcement yesterday, it did draw attention to our overall procurements of vaccines, which are very high in number. We have 194 million doses across 7 vaccine manufacturers, and we have options on a number of vaccines more to bring us up to a total of 414 million doses should we choose to exercise those options. In terms of Pfizer specifically, we have purchased 20 million doses of the Pfizer vaccine, and we have options on 56 million more doses. And so we are in good stead, Amanda, with our vaccine suppliers and in terms of our negotiations and procurements to date. And of course, we're following the science. So no vaccine would be distributed in Canada without Health Canada approval, and that includes the Pfizer vaccine, of course.
And we do know, assuming that it passes that approval, there's some complexities about this particular vaccine, including the temperature at which it has to be stored and the number of doses that might be required. How much in advance can you work through the logistics of all of that? Are you already trying to plan for the cold storage and the transfer and all of the rest of it?
Of course, and that's an excellent question, and it allows me to speak to the very complex logistics chain that we are putting in place to deal with not just the Pfizer vaccine, but any of the additional vaccines that do receive Health Canada approval. And in particular, we have multiple stages of the logistics procurement mechanism in place. We have the regulatory process, of course, which I've already alluded to. We have the biomanufacturing capability in terms of what we can do here in Canada. We've invested money in the NML's Royal Mount facility to bolster domestic production. We've purchased 3 fill and finish machines from a company out of Burnaby called VanRx. And then moving on to the next stage would be the distribution phase. We have been in touch with a multitude of companies after an LOI that we put out, and we plan to be putting in place contracts in the next weeks. And companies that came forward related to cold chain experts, couriers, and refrigeration companies, and there are a number of complexities in that chain that we're putting in place, of course, in conjunction with the Public Health Agency of Canada and my counterpart, Minister Haidu. And then we have the administration of the vaccine itself in the particular location where it is pursued. And we've already purchased a number of supplies in that regard. If I could just mention 90 million syringes, 100 million needles, sharps containers, 90 million alcohol swabs, 75 million bandages and gauze strips, and 90 million alcohol swabs from Cardinal Health alone. So just to mention that this logistics has been in place and being put in place over the last number of months, and we will indeed be ready when a vaccine is approved by Health Canada.
And an awful lot of logistics involved, clearly. One of the issues, of course, that will need to be sorted out, and I don't know if that will be your ministry or another, is just the priority list of who should get the vaccine. And I guess there's kind of a secondary or ancillary issue of what if people don't want it. Who's managing through the thinking on that?
Well, I will say that it is a cross-government conversation, and indeed a conversation that we're having with the provinces and territory. But the Minister of Health, Patty Hajdu, and her department are working very closely with the Public Health Agency of Canada to establish parameters around the issues relating to who should get vaccines first. Our Prime Minister has already mentioned, however, that we will be focusing, of course, on vulnerable communities and frontline healthcare workers to make sure that those individuals who are administering the vaccine and who are particularly susceptible do have access first. But the precise details and the parameters are still being discussed between the Minister of Health, cross-government, and with the provinces and territories.
You made an announcement today about rapid testing, easy access COVID-19 testing, millions of them. What does this represent, I guess, in the step towards, our ability to manage this next phase, which we're reminded, by none other than the president-elect yesterday, is still going to be a long and dark one. We still have the COVID-19 increases in front of us before we get to a vaccine. What does the rapid testing do for us?
Well, I want to start by saying that the rapid tests are supplementary to the standardized testing regime. That's extremely important to remember. And so in our acquisitions of various types of rapid tests, including the Becton Dickinson tests that we announced today, we have to remember that they're supplementary and they are going to be useful in specific settings. In particular, the BD antigen tests that I announced this morning uses a nasal test swab, which is processed in a handheld device or analyzer by a healthcare professional. And so we need to be very careful about where we're going to be using these rapid test kits. And of course, that is going to be a decision that the provinces and territories make themselves. As you know, they are responsible for dispensing healthcare. And so as a federal government, what we are doing is supporting the provinces and territories in establishing their testing regimes. And we are so pleased that we've been able to do that with the standardized tests as well as with the rapid tests. We will have first deliveries beginning before the end of the month and will continue throughout the rest of the year. And we want to make sure that we are right there for provinces and for Canadians every step of the way.
There's been a lot of concern about the lack of available testing, the way that testing's been handled. Rapid testing, Minister, is seen as key to reopening travel, for instance, as we see from the pilot project underway in Alberta. Is this part of a plan to try to roll out rapid testing and allow for some of that middle ground where we can actually go about our business and maybe loosen some restrictions?
There is no question that we need to be looking at a multitude of mechanisms or factors that will allow us as a country and an economy to return to some sense of normalcy. Of course, the standardized testing regime is front and center in that, and rapid tests will be in addition to that standardized testing regime. But as the Prime Minister and Dr. Theresa Tam have repeatedly said, we need to make sure that we are continuing to follow public health guidelines. Social and physical distancing is still recommended. Wearing three-ply masks is recommended. And we need to remember that there are multiple layers of the approach to attacking this pandemic. And we need to be conscientious about spreading the word relating to those multiple layers. And I don't want to forget the COVID-19 app that we are making sure, to the best of our abilities, Canadians know about and that they are signing on to so that they are aware of people in their vicinity who have contracted COVID-19 and can take the appropriate precautions.
Minister, we need to leave it there. We appreciate your time today. Anita Anand is Canada's Minister of Public Services and Procurement.